Hello everybody, we're going to talk about dengue versus malaria today. So dengue is caused by a flavivirus and is carried by the Aedes aegypti, Aedes albopictus mosquitoes. This is a febrile rash illness after the bite from an infected mosquito. After like 4 to 7 days you may get symptoms of dengue, fever, headache, body ache, muscle ache, fatigue, and a light red rash that you can when you press on it, it turns white, so-called blanching rash. The rash is not itchy and not painful. Malaria, you can also get fever after a few days incubation. Normally incubation is a bit longer, depending on the infecting load from the biting mosquito. And you can also get fever, headache, body ache, fatigue, but you tend not to get the complications that arise in dengue in the first few days if they are going to arise. The complications of malaria are slightly different from dengue. Malaria, the fever can come and go over several weeks, months, even years if it's not treated. Whereas dengue, the fever comes and goes and that's it. It doesn't really come back and persist like with malaria. The complications in dengue fever can include dengue hemorrhagic fever, where you get bleeding under the skin, bleeding from mucosal surfaces, including venipuncture sites, as well as from your rectum, from perhaps your eyes or your mouth. That's because dengue can shut down the clotting system and allow bleeding to continue when it should be clotting. Malaria can do this as well. In severe malaria, you might get a clotting cascade failure as well, but this is more common in dengue. And in dengue, you can also get a so-called shock syndrome, which is like septic shock, where the dengue causes a cardiovascular collapse syndrome, which can be life-threatening and needs rapid fluid replacement of the right type. And malaria can also do this in severely septic versions with high parasitemia of malaria. But generally, you can actually diagnose the difference between the two infections quite easily and quite quickly in the diagnostic laboratory setting. The treatments are different. Dengue, in fact, there's no direct antiviral treatment, although there is a vaccine for those living in endemic areas who are constantly exposed to dengue. In malaria, there are lots of different drugs you can use for different types of malaria for treating the parasite directly. And there is a vaccine in development for malaria. So they can present very similarly, malaria and dengue. The treatments are different, and the symptoms can be similar but progress to more severe disease in slightly different ways. But if you protect yourself from getting bitten by mosquitoes, then you can protect yourself from both malaria and dengue.